Good afternoon and welcome to the Department of Family and Support Services Health Services RFP webinar. Just a few housekeeping rules. Due to the volume of participants, everyone has been placed on mute. Please submit questions via the questions box and we will respond to questions at the midpoint and end of the presentation. Please use the questions box to notify us of any technical issues. This webinar is being recorded. Anything stated at this webinar is not intended to change the solicitation document. Any changes will be in writing in the form of an addendum issued by the Department of Family and Support Services. The purpose of this webinar is to provide information for the solicitation. A copy of the recording will be posted on the DFSS YouTube channel with the link to the recording under the alerts and/or funding opportunity tabs. Please give this 5 business days to upload. DFSS retains the right to share a list of registrants to this webinar along with their contact and organizational information at our discretion. At this time, I'm going to give Children's Services the floor to introduce themselves, and then we'll proceed with the agenda.
Good afternoon, everyone. This is B. Nichols, and I will serve as your programmatic contact. My information will come up. I think it's at the end of the slide. Thank you for joining us. Sheree.
Good afternoon, everyone. My name is Sheree Johnson. I am the Manager of Program Operations and Quality here in Children's Services, DFSS. I am here in support of B. Nichols as the lead for this particular RFP. Thank you for joining us.
Thank you. At this time, we're going to go through the purpose of the RFP, the background, information about the scope and program description, the selection criteria, timeline, technical assistance for applicants in e-procurement, and then one last round for questions. And at this time, I will give it over to Children's Services to start with the purpose of the RFP.
Thank you, Jillian. Again, this is B. Nichols. The purpose of the RFP. DFSS is seeking one entity to provide subject matter expertise, training, technical assistance, not only to DFSS, but also our directly funded Chicago Early Learning direct service providers. We're looking for the vendor to have subject matter expertise in the area related to health services and serve as a support service delegate agency. DFSS's Children's Services Division manages all community-based Chicago early learning programs that are funded through us. Children's Services Division seeks to ensure that these programs offer comprehensive and high quality programming for all enrolled children and families. We seek to build a strong system. This system must be guided by the 4 following priorities. Number 1, maximize access to high quality early learning programs by matching investments to the needs of local communities and reducing the barriers to entry for children and families. 2, improve the comprehensiveness and quality of early learning programs across all of our programs to ensure that children and families' needs are met. 3, meet the nutritional needs of children and families that they serve. And 4, create a strong system of service providers by increasing support and reducing the administrative burden for community-based providers of early learning. Give you a little background. DFSS always seeks to strengthen its health services systems, including relevant policies and procedures that ensure that health-related program performance standards are met, both across our network of direct service delegate agencies and their sites, and at individual agencies' sites that fail to meet CSD health-related monitoring performance measures. We want to develop innovative and effective practices for improving children's health at the grassroots level. Services that can be delivered through our direct service delegate agencies, daily and ongoing practices, and improve the health outcomes for low-income children and their families. The Children's Services Division uses support service delegate agencies with particular areas of expertise to supplement its management of programs and provide training and technical assistance to a variety of audiences, which may include DFSS staff, which are children's services staff, and staff of the direct service delegate agencies and their site staff, program parents, and families. It should be noted that support service subject matter experts will not deal directly with the children and families, but will provide consultation and training and technical assistance to leadership, managers, and direct service staff. Support service delegate agencies have specialized knowledge and expertise and/or credentials that support our programs and their management. DFSS, Children's Services Division, uses support service delegate agencies to ensure that SEL programs meet these three broad objectives. Number one, implementation of best practices in the early childhood development and education related fields. Two, compliance with relevant federal, state, and local standards and requirements. And three, improved outcomes for young children and their families. Goals. Children's physical development, well-being, and health are key components of school readiness. Children living in poverty are at greater risk of having untreated health conditions. What I'm reading to you now, these goals really stem from research-based, evidence-based briefs and other criteria. And you can see in the parentheses, we've cited those references, so you can look them up on your own a little later. Undiagnosed and/or unaddressed health and medical conditions can negatively affect development, not only in the physical domain, but also in the other domains, cognitive, social, emotional. Untreated health conditions in children are constant disparities and continue to grow for impoverished children. Children and families that are living in poverty and low-income communities tend to have increased exposure to environmental factors that negatively affect their physical development and tend to have higher rates of impairments like asthma, obesity, elevated lead levels, diabetes, and high blood pressure. Because of the importance of healthy physical development, access to regular health care for children's overall development and learning in our direct service programs, in compliance with SELS 2.0. This stands for the Chicago Early Learning Standards Manual that DFSS and the city put out to all of our agencies so that they know what our policies and procedures are. It is in the draft form for SELS 3.0 that will be coming out probably after this RFP and the bidder has been selected. And we'll make sure that we get that back out. HSPPS stands for the Federal Head Start Program Performance Standards. The IELDS and the IELG are Illinois State Board of Education standards. One is for preschool, the other one is for birth to 3. So all of these standards, federal and state, must have a system. The programs must have a system in place to ensure that children's healthy development is supported and tracked, and that their health needs are identified and met. Direct service delegate agencies, SEL programs must keep abreast of current trends in community health care that impacts children and families, and set policies and procedures that reflect best practices and research in children's health. Currently, SEL direct service agencies and their sites are responsible for the following services and activities: building relationship with parents and guardians that allow for ongoing communication and collaboration about their child's health and well-being; establishing partnerships with local resources that can support children's health, including local health providers; ensuring all children have regular and up-to-date physicals and screenings in alignment with the EPSDT, or early periodic screening, diagnosis, and treatment standards; ensuring all children have age-appropriate hearing and vision exams and follow-up treatment as necessary; and maintaining an update to their health history file for each child. Next slide. Ensuring all children have up-to-date immunizations, that they have regular height and weight assessments, establishing and updating as necessary written policies and procedures, ensuring children have health insurance and a medical home, ensuring children are in need of follow-up treatment and any type of medical condition that they receive that treatment, creating and maintaining plans for children with special medical conditions that ensure that they get the ongoing support that allows them to attend programs, and ensuring that staff get training that allows them to support those children. Establishing and/or maintaining up-to-date policies and procedures for temporary exclusion of children, thus reducing transmission of communicable diseases and conditions. Establishing and/or maintaining daily health checks, ensuring all children and families' health information is up to date and entered into whatever system the Children's Services Division is using to track it. Establishing and maintaining a local health services advisory committee. Next slide. Target population. The Chicago Early Learning Programs provide low-income and at-risk children ages birth to 5 and their families with high-quality, developmentally appropriate wraparound services so that they are school-ready when they begin to matriculate into kindergarten. Research indicates that children from low-income backgrounds enter kindergarten less school-ready than their more affluent peers, meaning that they underperform on measures of cognitive, social, emotional, physical development, and that this, and I would also add speech, and that this disadvantage continues through the school years and beyond. SEL programs are designed to address this school readiness gap by providing children with high quality early learning and development experiences, ensuring that children's health and physical development needs are met, and engaging parents, families, and communities in supporting their children's development. DFSS administers SEL programs through a network of contracted direct service and support service delegate agencies. We contract with a network of around 89 direct service delegate agencies across about 218 sites that implement program models designed to meet the local needs of Chicago families. These program models exist in a variety of settings. It could be center-based, home-based, or family child care home settings. In total, these programs are referred to as CEL programs that reach over 14,000 children and their families. Program requirements. The Health Support Service Delegate Agency will be required to develop and deliver training sessions and provide technical assistance and consultation in the area of health services to DFSS and its direct delegate agencies to ensure that DFSS and its agencies meet health-related requirements that are listed in the program description of this RFP. DFSS intends to contract with one entity to provide these services citywide that can meet the following required qualifications and conduct the following required activities. Qualifications. We would expect that the entity would have on contract at least one licensed pediatric doctor of medicine or doctor of osteopathy who can serve as the primary consultant to DFSS Children's Services Division and co-chair, disregard the 8, the Health Services Advisory Committee. There's only one Health Services Advisory Committee, but that committee also has various subcommittees. There are 3 subcommittees to the Health Services Advisory Committee. And so we're looking for this pediatrician to serve as our main health subcommittee lead, as well as provide subject matter expertise to DFSS. Next slide. We would like for the entity to provide a project manager who acts as the point of contact for all activities related to the scheduling and coordination of services and activities. Demonstrate the staffing capacity and credentials to conduct the services and activities required of this contract, including having on staff or under contract a cadre of nursing professionals, 7 to 10 full-time employees. And that is negotiable. You know, after you take a look at what we're asking, if we need to take a deeper dive and look into the capacity of the staff, we can do that, including registered nurses, licensed practical nurses, or nurse practitioners to conduct activities that require qualified nurses. We like the entity to demonstrate expertise in children's health and healthy development, community health, and its impact on child development and social determinants of health, and how they impact children's overall health and nutritional development, as well as the gynecological health for pregnant women and lactation consultation. We'd like the provider to demonstrate a working knowledge of one or more of the following and demonstrate the capacity to acquire expertise in the following: health and nutritional requirements for children ages birth to 5 in our programs, as well as all of the earlier standards and requirements on a federal and state level, as well as DCFS licensing standards. You'd have to demonstrate the ability to interpret and explain health policies that affect children ages birth to 5, have familiarity and compliance with all HIPAA and FERPA requirements, as well as the experience providing training and technical assistance to adult learners on topics related to health services. Successful respondents will be required to perform the following activities: act as DFSS's subject matter expert in all areas related to children's health by providing guidance on these subject-related policies and procedures, the development of policies and procedures, policy memoranda related to best practices, research, program requirements, and standards. We expect them to consult with DFSS to provide clarity on program components, service expectations, program requirements, and standards. Advise DFSS and its programs on current and new health issues as they arise, especially as they relate to the cell service population and its well-being and cell program requirements and standards. Acting as the co-chair of the Quarterly Health Services Advisory Committee and chair of the Health Subcommittee, support DFSS and its direct service delegate agencies in forming these community partnerships with local providers of health services so that agencies can defer children and families for services as needed. This includes collaborating with DFSS and its agencies in identifying gaps in health services and making recommendations for improvement, including recruiting community and local health providers to partner with direct agencies and sites in underserved areas, and to be enrolled in children's medical homes and support DFSS and its agencies in forming community partnerships and agreements. Provide ongoing regular training and workshops for direct service delegate agency staff on the program requirements, best practices, and other subjects related to health services. You should expect to provide at least 4 trainings on an annual basis. These topics include health issues in group care, safety issues in group care, child growth and development in infants and toddlers, as well as preschoolers, importance of identifying a medical home for parents, prenatal and postnatal education, safety practices, social emotional development, asthma action planning, OSHA guidelines on bloodborne pathogens, and special healthcare plans. Performance goals and objectives. In order to track toward achieving the outcome goals of this program and access success, DFSS will monitor a set of performance indicators that may include, but are not limited to, direct service agency compliance with all of the federal, state, and local standards and requirements after receiving intensive training and technical assistance from the Health Support Service Agency. Monitor and recognize intermediate progress towards the above performance standards. DFSS will also track output metrics that may include, but are not limited to, the number of trainings that are provided to our direct service agencies and sites, the number of hours of intensive training and technical assistance provided to DFSS identified direct service agencies to strengthen their health systems, the number of completed direct service agency training plans and corrective action or quality improvement plans, the number of community partnership collaborations supported, including the number of medical homes that are obtained by our children that are enrolled, the number of hours provided to HASAC, which is the Health Services Advisory Council Committee, and its subcommittees, the number of parent consultations that are provided, the number of delegate and partner agencies site observations and consultations that are conducted, the number of individual child and pregnant mom plans that are supported. And in addition to the performance indicators and output metrics that are listed above, DFSS encourages applicants to propose additional indicators and metrics, including those that demonstrate early success and are indicative of participants' progress. All right, I'm going to go through this section of how we select our vendors. And then after that, after this selection criteria, I'm going to turn it over to my colleague, Sheree Johnson. So in the selection criteria for community involvement, DFSS will evaluate applications based on the following criteria: that you demonstrate a clear understanding of the target population, including strengths and assets, needs, and challenges. Demonstrate client and community engagement activities that inform service delivery, expertise working with the target population, and relevant capabilities and/or infrastructure needed to serve this group. The respondent demonstrates a commitment to leadership and engages the people of the communities it serves. Next is organizational capacity. Next slide. The respondent has qualified staff that are responsible for program oversight and management. They have adequate systems and processes to support monitoring of program expenditures and fiscal controls. And the respondent has the capacity to collect and store data. Next slide. Strength of the proposed program. DFSS will evaluate applications based on the following criteria: that you clearly define services to be provided, either directly or through partnerships or linkage agreements with other agencies that are appropriate to addressing the needs of and achieving desired outcomes for the target population. That the proposed program is supported by a strong national or local evidence base or aligns with best practices for the relevant field. The respondent has an effective approach to identifying and retaining program participants, including rules and regulations that reduce barriers to participation. The respondent has partnerships or coordinates with other agencies to expand or improve services in a client-centered, comprehensive way. Performance management and outcomes. You will demonstrate evidence of strong past performance against desired outcome goals and performance metrics and/or other notable accomplishments in providing services to the target population. The respondent has experience using data to inform and improve its services or practices. The respondent has the relevant systems and processes needed to collect and store key participant and performance data. And then lastly, reasonable costs, budget justification, and leverage of funds. We're looking to see that the respondent has the fiscal capacity to implement the proposed program, that you leverage other funds and in-kind contributions to support total program and administrative costs, For example, state, federal, foundation, corporate, individual donations. And that you demonstrate reasonable implementation costs and funding requests relative to its financial and human resources. The proposed budget supports the proposed scope of work or work plan. And with that, I am going to turn it over to my colleague. Oh, let me finish this last slide. I'm sorry, Sheree. Attachments. What we want to see is that you attach any reports, studies, or other documentation that show performance towards reaching the program goals, demonstrate results and accomplishments. So other work that you've done that you have been successful in, we encourage you to submit that information. Be sure to attach resumes for key staff that are overseeing the program and attach your organization budget. In this proposal, we're asking for a cost proposal, and we'll talk about that a little later. But make sure that all program requirements are addressed. And with that, I'm going to turn it over to Sheree.
Thanks, Steve. So now we're going to talk about the evaluation process. You'll be evaluated on the strengths of the proposal and the responsiveness to the selection criteria that we just mentioned and reviewed. Failure to submit a complete proposal or fully respond to all requirements may make your submission rejected or subject to rejection. The commissioner, or here at the Department of Family Support Services, we have an acting commissioner, will, upon review of recommended agencies, may reject, deny, or recommend agencies that have applied for grants based on previous performance and or area need. DFSS reserves the right to ensure that all mandated services are available citywide and provided in a linguistically and culturally appropriate manner. So on your screen, you have the selection and transition timeline. So today is our pre-proposal webinar, April 25th, 2025. The due date to submit pre-proposal questions is April 30th, 2025 by 5 p.m. Central. Applications are due by Friday, May 16th, 2025, and they must be submitted via the online application. Email or fax submissions will not be accepted. I'm going to read that one more time. Applications are due Friday, May 16th, 2025. They must be submitted online via the information that will be reviewed shortly. Emails and faxes will not be accepted for this submission. The program period begins, and again, this is contingent upon funding in the anticipated contract, but the current term that we have listed is July 1, 2025 through November 30th, 2026. So we previously mentioned that for this particular RFP, there is a cost proposal that we will be asking for. So we ask that you please submit a budget for 1 year. So that's for 12 months of services. This RFP contains a cost proposal that will require projected unit rates for activities. Be thoughtful and inclusive when developing your budget. Consider your program's actual costs and market rates. We generally cannot give you more money than what you've asked. So the specific dollars that are listed within your budget and cost documents is what we would potentially provide for this particular RFP. Use the reasonable cost question on the application to discuss how you determine the cost reflected in the budget. A federal match is required. Administrative cap or indirect cost is at 33.3%. Common mistakes that we've seen on budgets such as these: fringes. Check your calculations. Of course, we have to ensure that numbers align. Supplies. These are frequently under or over budgeted for. Client assistance. Make sure your job description titles and your job description uploads have the same titles. Everything, again, must align. Also put a brief description of the job in the budget document itself if you have not discussed it specifically in your application. Put your budget in the appropriate column. So again, reviewing to ensure that everything is accurate and aligned. and you must show your match. Again, we are reiterating that applications are due Friday, May 16th, 2025 at 12 noon Central Time. Any submission after that date and time will not be accepted. And now I will turn it over to my colleague, Jillian, who will review additional application tips. You're on mute, Jillian. There you go.
Thank you, Sheree. First, I would like to give a small pause for any questions. Please put your questions in the chat box. We will pause for questions towards the end of the presentation as well, if you don't have any questions at this time. So I'm going to start with application tips. We can't stress enough for applicants, potential applicants, to start your applications as early as possible and to save it as often as possible. And if you have never done business with the City of Chicago, please register into iSupplier, also known as e-procurement, as soon as possible. Review RFP narratives and application questions closely. Remember that they align with the scope and the selection criteria in the RFP. Please use the RFP for guidance in formulating your answers. There is a 4,000 character limit in e-procurement, which includes punctuation and spaces. And each response is allotted 4,000 characters. Please try not to use the back button on your browser. You may potentially lose your work. And again, start your application as early as you can. Some tips for working in e-procurement. To submit multiple applications for a single RFP, applicants will need to set up a unique user account in iSupplier. The e-procurement system is not capable of submitting more than one distinct proposal per associated email address. Therefore, you must use a separate email address for each submission. You can submit your application and later amend it up until the due date of May 16th at 12 noon. Avoid the rush and possible mishaps by submitting early, and plan on your submission taking approximately 30 to 60 minutes. Please be advised that late applications cannot be accepted. For assistance, make use of the e-procurement hotline at 312-744-4357. They also can be reached at customersupport@cityofchicago.org. Please note that the hotline operates during business hours only, which is Monday through Friday, 9 a.m. to 5 p.m. Some agency requirements. We require agencies to provide articles of incorporation and any amended articles of incorporation. We also require an IRS affirmation letter, which is for not-for-profit agencies only. This letter must be dated within 60 days of submission. And you can obtain this letter by calling the IRS directly at 1-877-829-5500. If you are a for-profit agency, submit your original letter from the IRS showing your FEIN number. A UEI number is required in addition to essential contractor registration, which can be obtained on the entity overview page on the www.sam.gov website. And lastly, a certificate of good standing letter with the state of Illinois is required. As of April of 2024, we do have a labor peace agreement ordinance, which will apply to all DFSS and CDPH delegates that have 20 or more employees working for their organization. The only exemptions are hospitals. Contractor must provide written notice to the commissioner or her designee within 72 hours of becoming aware that employees want to organize or that a union seeks to represent employees. Contractor must enter into an LPA within 90 days of receiving notice from a labor organization that it seeks to represent employees. What is an LPA? An LPA is an agreement between an employer and a labor union that ensures that an organizing drive is not impacted by union busting techniques, including employee retaliation, and in return, they will not strike or stop work in a way that will impact human services. For technical assistance, there is a link on the DFSS webpage to the RFP of interest and training documents. Please see alerts section on our website. For questions on registration and e-procurement technical assistance for delegate agencies, please reach out to customer support at cityofchicago.org, and they also can be reached at 312-744-4357. In addition to the technical assistance, we also have training materials, which includes documents and videos on our City of Chicago website under online training materials. At this time, we're gonna delve into how to accept your amendment and enter your response. Select create quote from the drop-down menu in the actions box, and then you click on go. In this action will take you to the application page where you can get started. If the RFP you are interested in has been amended, you will need to acknowledge and accept the amendment to start or submit a response. To accept the amendment, click on View Amendment History. Next, to begin the acceptance and acknowledgement process of your amendment, follow these steps after clicking View Amendment History. First, you click on the document number. Next, click on the affinity or eyeglass icon to review the amended changes of the RFP. Next, you click on Acknowledge Amendments button to acknowledge receipt and understanding of the changes to proceed. And by acknowledging the amendment, you are indicating that you are aware of the changes made to the RFP in the amendment. When you get to this screen here, you click on the I accept checkbox and then you click Acknowledge. Next, you click on Yes to indicate that you confirm your acknowledgement of the amendment. Finally, click on the checkbox that you accept the terms and conditions, and then click Accept to accept the terms and conditions. And that is the final step in acknowledging and accepting the amendment. Once the amendment has been accepted, you can then proceed to submitting your application. So once you have answered all of the questions in the RFP and you've attached all required documents and you are finally ready to submit, you can start by saving your draft one last time and then clicking continue. Once you click continue, if you receive a red error message, you are probably missing something, you're missing information. So it's very helpful that the system will give that notification. Usually that error message directs to something left undone in the application. In the last example, the error message indicated that the lines had not been filled out. In this example on this page, the error is about an unanswered question in the application or requirement section. The quote value refers to, in this case, your missing answer. So once your application is free from errors, you are now ready to proceed and submit your application. And at this point, clicking continue should put your application into the review and submit phase. Once you get to this screen, this is the summary page. And this is also your last chance to review all of your data and confirm that everything is accurate. So please check all of your attachments, all of your responses to the requirement questions, and scroll down to the bottom of the screen to see all of your responses. And at the very bottom of the screen, you will be asked to provide an electronic signature. Please be sure to fill in a signature before checking the box. And then once you check that box, then you can click submit. Once you submit your application, you will receive a submission confirmation screen from eProcurement, which looks like this. It's on the screen right now. The eProcurement system will send this confirmation email within 24 hours of your submission. However, if you want it sooner than that, please feel free to email me. My name is Jillian Black. I can be reached at jillian.black@cityofchicago.org. We're gonna pause again for questions. And please keep in mind that if you don't have any questions right now, you still have time to submit questions up until Wednesday, 5 p.m. Wednesday is April 30th. So April 30th, 5 p.m. is the deadline for questions regarding this RFP. And those questions can be forwarded to Beatrice Nichols. She can be reached at beatrice.nichols@cityofchicago.org. And then for any non-programmatic questions, if you have questions regarding eProcurement or you're having issues with eProcurement, please reach out to the eProcurement hotline at 312-744-4357. Again, they're open Monday through Friday, 9 a.m. to 5 p.m. And they also can be reached via email at customersupport@cityofchicago.org. And you could also send those non-programmatic questions to me as well. My information is on the screen, jillian.black@cityofchicago.org. And at this time, I'm going to turn it over to Children's Services if they want to add any closing remarks before we close out.
Thank you, Jillian. Thanks,
No
Sheree.
problem.
We can't thank you all enough for doing the work that you do, and for considering this opportunity. It's going to really support us in the Children's Services Division. We know that this is a time-consuming and somewhat complex process, but we really look forward to your submissions and submitting. Hopefully, you'll submit a proposal. Don't leave it in there too long. Go ahead and complete that application as Jillian has walked you through. And we look forward to working with our successful bidder. Thank you.
Thank you, Beatrice. With that being said, I don't see any questions. Again, the question deadline is Wednesday, April 30th. And sure, yeah.
I keep raising my hand. I'm so
Okay.
sorry. That's an error. I'm so
No problem.
sorry. I don't know why, but thank you, everyone. Nothing's wrong. You
guys.
did great.
Thank you, everyone, and good luck on your submissions to the RFP. And thank you for attending this webinar, and enjoy the rest of your evening. Thank you. Bye.
Thank you, everyone. Bye-bye.
Thank you.